We are here today to talk about this young woman and her personal experience with heart attacks.
My husband was mowing the lawn last week and he fell to the floor. The doctors later diagnosed him with a heart attack.
Some common side effects and symptoms of it would be pressure, lightness, pain, squeezing and aching sensations in the chest or arms that may spread to your neck, jaw, and shoulders, and nausea, indigestion, heartburn, and abdominal pain, shortness of breath, cold sweats, fatigues, and lightheadedness or sudden dizziness is also common in that.
Has your father experienced any of these symptoms?
Yeah, most of them.
A heart attack is also known as a myocardial infarction, and it's the number one killer in both men and women in the entire population of the United States. Each year, around 700,000 Americans suffer a heart attack. A heart attack occurs when the blood flow is cut off or severely reduced, like per se a clot. The blood needs oxygen, and when the blood clot forms, it prevents the blood from getting that oxygen.
Can everyone experience the same symptoms?
Well, no, not everyone who has a heart attack can experience the same symptoms. Example is someone would have mild pains where some others would have severe pains. Some people can show no signs or symptoms and just fall directly into cardiac arrest. Everyone is susceptible to a heart attack. However, some are more likely to experience one than others, and those with high cholesterol have a higher risk of a heart attack than someone with low cholesterol. About 1/4 of all attacks are silent, meaning that you can't feel them coming or detect them at all.
There are also many tests and treatment option strategies that have been made for the heart attack. First of all, there are two types of heart attacks that are treated differently, although they both have common ground. There are the STEMI and the NSTEMI. The procedures that helps restore blood flow is called percutaneous coronary intervention, or PCI, which is a mechanical way of treating a heart attack. About 1/3 of all hospitals in the US are equipped with this technique. You can also get clot-dissolving drugs, surgery, or even balloon angioplasty. If you had an NSTEMI heart attack, doctors typically use one of two treatment strategies. The Ishima-guided strategies uses various drugs to prevent blood clot formations. Medical therapy of PCI with stenting or coronary artery bypass grafting, CABG, followed by a certain type of post-hospital care. There are also some recent technological developments in diagnosis, treatments, and management. There's a study called Jupiter which focuses on inflammation. Inflammation is your body's own defense mechanism, mobilizing the immune system to combat an infection or injury. Now doctors can measure your level of inflammation by a blood test called high-sensitive CRP. The study was to see if people with high CRP and normal LDL, which is bad cholesterol, would benefit from a sustained drugs. The results came in showing that the middle-aged volunteers who take the drugs have reduced risk of a heart attack and by 44%. Up to 20 million Americans now use the sustained drugs to help reduce their risk of a heart attack or a stroke. And it also has minimal side effects.
Yeah. Can you actually reverse a heart disease or just slow it down?
Well, you can actually undo most of the damage at about around 90% from the causes of heart disease, but it would take serious change to your life, and it would not be able to reverse the full damage unless you got a heart transplant.
What are some ways you can reduce the chance of having another heart attack?
Well, some ways that you can reduce your chances of having a heart attack is you can stop smoking if you are a smoker, you can engage in physical activity, you can use diet therapy, you can maintain or reduce your weight, you can control your blood pressure, or you can undergo cholesterol control or stain therapy, which is basically the Jupiter project that they're testing. You can control your blood pressure, and you can also limit your alcohol intake.
Thank you for helping me spread awareness and inform me about my husband's situation.